are dealing with executive function and focus problems. And then on top of that, you are hit with a slew of cognitive cloud. You feel like you are pushing through mud. You feel just low and not interested in being around it. How are you expected to parent or do anything else? Like, it's just like, that's an added layer of so much complexity.
Are you overwhelmed by motherhood and barely keeping your head above water? Are you confused and frustrated by how all the other moms make it look so easy? You can't figure out how to manage the chaos in your mind, your home, or your family. I get you, mama. Parenting with ADHD is hard. Here is your permission slip to let go of the Pinterest-worthy visions of organization and structure fit for everyone else. Let's do life like our brains do life, creatively, lovingly, and with all our might. When we embrace who we are and how our brains work, we can figure out how to live our lives successfully and, in turn, lead our families well. At the end of the day, we just want to be good moms. But, spoiler alert, you are already a great mom. ADHD does not mean you're doomed to be a hot mess, mama. You can rewrite your story from shame spiral to success story. And I'll be right here beside you to cheer you on. Welcome to Motherhood and ADHD. Hey there, Successful Mama. It's your friend, Patricia Sung. This episode's been sitting on my heart for a while, and I wanted to give you a really solid episode on what does ADHD look like in women and when should we go get a diagnosis. But in true ADHD fashion, it felt so big and important that I didn't know where to start. And the other day, I was watching Instagram Reels and Dr. Sasha was explaining ADHD in these little digestible moments of clear understanding. And I was like, man, she's exactly what I need. So I invited Dr. Sasha here to talk with us. What does it look like? And when is the right time to go ask for help? We are talking through your questions. I asked you in our Motherhood and ADHD Facebook group, what do you want to ask Dr. Sasha? What do you want to know about the symptoms of ADHD in moms? And we go through what kind of patterns we should be looking for to know, maybe this is something I need to look into. How a lot of us feel like we're tricking our doctor into believing that we have ADHD when we really don't. We also talk about the difference between using our ADHD as an excuse or is it the explanation for how we are and who we are and what we do? We also can't pass up on the glaringly obvious problems of dealing with our hormones and how do we deal with the emotional roller coaster that is having ADHD. Dr. Sasha Hamdani is a board-certified psychiatrist and an ADHD specialist. This is her bread and butter. This is what she does every day, is diagnose people with ADHD and help them treat it.
Let's welcome Dr. Sasha to the show. Thank you so much for being here today.
Thank you for having me. I've been excited about this for a while.
Obviously, I could ask you 400 questions, but in the shortest ADHD possible way, can you give us like the Reader's Digest version of how you came to find out that you had ADHD? Because that's one of the things I find interesting about your story. I know it's a long one, but
yeah.
That like discovery process of like how you were feeling, because that's one of the things that a lot of moms really appreciate is just knowing they're not the only one dealing with these feelings.
Yeah, absolutely. So in fourth grade, I was 8 or 9. I insurrected a revolution in my classroom. So I got all the kids to stand up on their desks, started chanting at a substitute teacher. Shortly after, my teacher was like, yeah, we've seen a lot of disruptive behavior, brought it up with my parents, and my mom's a pediatrician, got me in to one of her partners, and I was diagnosed and started on medication. My parents are wonderful, highly educated people, but they were also, this is in a time where ADHD wasn't diagnosed a whole lot. And so they were a little bit concerned about the stigma component of it. And so they didn't tell me, and they told me I was taking vitamins. And my vitamins were awesome. I did really well. I was on the same dose of these vitamins all the way up until the end of high school. And I did well enough through my academic schooling that I got into medical school straight out of high school, but that was out of state. So when I got there, everything kind of fell apart. I didn't know, I literally could not get my bearings. I didn't know how to feed myself. I didn't know how to sleep at a normal time. I obviously wasn't taking my vitamins. So my parents were like, okay, they're actually not vitamins. It's ADHD medication. This is what you've been diagnosed with. So then there was a lot of betrayal and a lot of I just was in denial. I didn't believe that I had that diagnosis. I thought it was for boys. This wasn't anywhere on my radar. And I felt like, I had been drugged into performing, and I just hated the whole aspect of it. And then as I kind of progressed through, I'm like, okay, wait, I actually do have this. This is exactly me. And so then the rest of my journey throughout medical school was trying to figure out and get my bearings and actually come to an understanding of what it looked like in females and what it looked like in me. And that kind of propelled me into eventually psychiatry and then in becoming an ADHD clinical specialist. That's a short version.
Well, and the reason I ask about that is because there are so many parents who struggle with, how do I tell my kid I don't want them to be labeled at school? And like you said, we don't want to throw your parents under the bus, because we all do our best. We do as much as we can with the information we have. And back then, I'm assuming you're about the same age as me. In the 80s, there was not a lot of information out there. And so what were our parents to do?
Right.
So like knowing that we're not throwing your parents under the bus, like what would you say to parents now who know that their kids have this, but are afraid to have that conversation? And rightly so, because of all the stuff that comes with it.
Yeah.
Now that you're on the other side of it, what would you tell them?
I've thought a lot about this. I've thought a lot about how this kind of came about. And I thought about my parents' decision not to tell me. And you know what? I think if I was in their position, I don't know if at that time I would have done anything differently. So I don't blame them for that. It's gotten me to that point where, especially now that I'm a parent myself, you become more aware of your child's emotional needs as well. And that kind of shifts what you feel like you can disclose to your kid. So as a parent now, if you're struggling with something like that, if you're like, I think my child has ADHD, I've gone through this diagnostic process and I don't know how to tell them that. Honestly, my thing is, because I have this conversation every single day in my practice, I think the best way to arm a kid is to tell them what's going on, but phrase it in a way that they can understand, and phrase it in a way that it's not a judgmental thing, that they can take ownership and figure out how to navigate that stigma. Because I think rather than having them feel oblivious about it, because I think what my biggest struggle was as I was growing up, if I had known about the ADHD, I think there would have been a lot of times where I wouldn't have felt so isolated or different or alone. And I think that that's something really difficult that a kid has to navigate. So I think there are benefits. I think the benefits of telling your child that they have ADHD far outweigh the negatives. But I think just how you phrase it, know your kid. Like if your kid is really scared about being different, then it's something like everybody's brain is wired differently. And so this is just how your brain is wired. So we have to figure out a way how to play out your strengths. So things like that. You don't phrase it in a negative light, because the truth be told, ADHD, it comes with a lot of things that are not so great. But there's certain strengths that can absolutely be capitalized, and you can be very, very successful with it.
Beautifully put. And that's often the guidance that I give as well, is that without the information, we assume it's us.
Yeah.
We assume we're the problem and we feel alone, and we don't have the words to put to that struggle. But when you have an answer, it's like, well, you know what? If people are going to think I am spacey, they're going to think I'm spacey whether I have ADHD or they don't know I have ADHD. So if we have the words, so that it's really more about my internal struggle as the person, and having that knowledge and the ammunition to move forward, as opposed to like, people gonna think what people gonna think. Like,
yeah. Yeah.
So where would you say, when you think of like the big picture of motherhood, that your ADHD affects you the most?
Can I give two answers? Because I think it's a tie. I think number one is like the stuff you think about. It's the executive function of all of it, because now I'm not in charge of just taking care of myself, which admittedly can sometimes be a challenge on its own. But now I have to take care of that for two other tiny little humans. And so it is, managing to stay on top of doctor's appointments and vaccinations and all of these other tiny minutia that you, as an adult, you're just like, I can put that off. Like you can't put it off for a kid. And so it's a matter of staying organized. And especially when you start getting them, my babies, one is turning 2, he'll be 2 next week. And the other one is 3. And so now, we're entering school for one of them. And so like with the schedule shifts and pick up and drop off, it's just like an added layer of complexity. So I think that is what you would have guessed is a difficult part of motherhood. Honestly, for me, I think one of the other things that I've really struggled with is my whole life. I've known I've wanted to be a parent. Like it's from birth. I'm like, this is what I want to do. And then I was lucky enough to get pregnant. And during that pregnancy, like I was on Pinterest every second of every day, like thinking this is what it's going to look like. And then you become a parent and you're sleep deprived and you're juggling your own limitations and things like that. And I think one of the things that I've really struggled with is my emotional regulation throughout that, because I want to be an active parent. I want to be a present parent. I want to show them and model them good behavior. But there's sometimes where I will absolutely lose it. Then it's a matter of like, what's my explanation? How do I explain this behavior? Why was this so upsetting to me? Is it because I didn't sleep very well? Is it because I'm overwhelmed? So it's learning to kind of trace back and then how to explain that to your kid as well. Because I think to some degree, I try to be very mindful about how I operate, but that some stuff falls through the cracks. For sure.
No, that hit home because I was a teacher before. Kids were my job. And I thought I was going to be this amazing mom. And then I got into being it and I was like, this is not what I expected it to be. Like it was so much harder. And the whole emotional regulation piece is the entire reason that I end up sticking with my medicine is because it evens me out and I don't turn into Medusa mom at bedtime. Like,
yeah,
that's the main reason at this point in my life. Like that is the main reason is to help me deal with that.
I understand that more than you'd ever know.
And where would you say that your ADHD really shines in being a mom?
I hope this doesn't sound, again, I am also sleep deprived. So if this sounds braggy and gross, I apologize.
Well, pretty sure everybody listening is too, so don't
worry. Okay. This could probably be a positive or a negative, but I find it to be a positive as of late, that it allows me to interact with my kids in a very joyful way. Like I really enjoy playing with them, exploring new things with them. And so my husband will always be like, you're just a fun parent. Like it's fun to be around you. Now, in terms of maybe I'm the fun parent because I just can't get the other stuff together well enough. So he has to take that over. But like asking questions and natural curiosity. And it's fun to see kind of like patterns of my own interest and engagement mirrored in my kid. Like I'm interested in that. And so are you. This is so cool to watch and see and grow together. So I really enjoyed that aspect of it.
So I was thinking about this episode and wanting to dive into like a true understanding of what should we be looking like. Like there's so many moms that come in to my hemisphere of the internet here and like, what does ADHD look like for women? Like, and I even polled the audience on what kind of questions they wanted to ask you. And one of the most frequent ones was like, when should a mom look for a diagnosis? Like, how do we know that this is something that I need to look into, because everyone's ADHD is different. It's not just this whole like missing attention. Oh, they're not paying attention. Like that's what we hear on the like megaphone, but really there's just so much more layers underneath that. Like, and when I have been watching your reels recently, I was like, oh my goodness, like Dr. Sasha, she's the one. I got to get her on here and talk about this. Oh, I just said a lot of things. So let me roll back one question at a time. The first one is when a mom opens this door to, they open Pandora's box and it's like, whoa, this is what ADHD is. Maybe it's because their kids have it, or the Instagram algorithm has diagnosed them by starting to show them all these relatable things. And a mom who's literally just opening this door and is like, whoa, this is a little too relatable. How does she know it's time to look into getting a diagnosis?
Honestly, if you ask yourself that question, it's time. And the reason I'm saying that is, full disclosure, access to care is such a nightmare, and finding a physician. And I feel like our system is inherently kind of broken. So the people who need care the most, it's like most difficult to get to. But if you have access to care, if you have insurance, if you have all these things, if maybe the steps aren't as obscured for you, then if you have a question about whether or not it could be, that's a question that you need to kind of bring up to your practitioner. You don't have to figure it out on your own before seeing someone. You don't have to be like, I've fully diagnosed myself and now if you have questions, a diagnosis of ADHD is very multifactorial and complicated. Like you have to look at your medical background, you have to look at psychodynamic features, you have to look at other interplay of medications and other psychiatric phenomenon. So there's so many other things going on. Having a trained clinical, like a physician or a therapist or someone who can diagnose you and then potentially treat you is so vital, because they will synthesize all the information that you have floating around in your head. And maybe you go there and they're like, no, this isn't ADHD. But what they should be giving you is they should be giving you an adequate explanation for why you're having those symptoms. If they try to tell you that's just being a mom, that doesn't count. It doesn't count as an adequate explanation. I'm talking about like if you're having difficulty focusing or difficulty completing tasks and they're like, no, it's definitely not ADHD, then tell me, what is it then? Why am I doing that? Is it because I have an underlying anxiety? Is it because my depression isn't fully treated? Is it because I have this external stress that's preventing me from sleeping? Like, there are things like that. You just have to kind of work with someone to amalgamate that information, but you don't need to get to the finish line before you go and get diagnosed. Like, if you have that question, go and get treated. Go and at least get those questions answered.
How does a mom know that this is the right person to talk to? So I feel like I hear a lot that like their physician didn't really hear them or told them, one of those just said you don't have it, but didn't fill in those blanks. Like you just said, like, how do they know they're talking to the right person?
This is part of the problem. This is why I have like series, and this is actually part of the reason I started advocacy on social media, because I feel like getting good evidence-based and accurate information about ADHD is really difficult. What I would say is that seek out care where you can get care. If you feel uncomfortable with either the diagnosis or the way the diagnosis was relayed to you, or if your questions aren't being adequately answered, seek out a secondary opinion. If you had absolutely every resource available to you, I typically say start with a psychiatrist if you can, just because out of all of the other clinical realms, a psychiatrist has gone to medical school, so they can diagnose you from a medical perspective. They've gone through residency, so they are familiar with the psychological phenomenon. And through that psychiatric residency, they're the best trained out of all other clinical physicians in ADHD, because ADHD is part of psychiatry. And they're the best versed at those medications if medication is appropriate. Now, that's not a hard and fast rule. And I feel like generationally, there's a bit of a gap here too, because like as humanity has evolved, ADHD, yes, it wasn't talked about in society. It also wasn't talked about in medical circles as much as it is today. So physicians and psychiatrists from an older generation might not be as savvy or up to date on clinical dosing things and strategies, or they might be a little bit scared about the medication. So if you had complete say over who you wanted, I would go for a psychiatrist, and also a youngish psychiatrist that has been trained in the past 10, 15 years. I'm almost out of that window. Okay, but like 20 years. But like the other thing is just research, like go online ahead of time. And, the thing about psychiatry and probably all physicians is that there's going to be some outliers. There's going to be some people that are upset about things that are completely unrelated to the physician. But if you're seeing a lot of stuff like, this person didn't listen to me, this person was dismissive, this person was rude, if you're seeing a repeated trend of that, you don't want to see that person. You don't want to look for trending thing. If it's one isolated thing, that could totally be an outlier, but you want to look and try to have a good idea of what you're seeing, what you're looking for, because you're trying to figure out the person who can work with you collaboratively, that can work with you to help you figure out what the diagnosis is. So it needs to be a good relationship.
I know that when you actually do a diagnosis, like that person should be looking at your full history. So I'm just going to put this disclaimer on this episode. Like, we are not diagnosing anybody today, but here are some things to look for. Obviously looking through your past history is a really important part. But for that mom who's looking for like, what are these red flags I should be looking for that would indicate, hey, maybe this is it? Like, what kind of themes do you see in your patients who have ADHD as adults and haven't been diagnosed throughout their childhood?
So for women in particular, a great majority of them fall into the inattentive category. And whether or not that's actually accurate, like if genetically and phenotypically they fall into this grouping and they all look inattentive, I don't know if that's necessarily true, or whether they've just kind of socially adapted to like kind of work around some of that hyperactivity and impulsivity. But For the inattentive signs, you're looking for difficulty maintaining attention in tasks. You're looking for difficulty with organizing things. You're looking for difficulty with multi-step problems. You're looking for difficulty with like careless mistakes. Like, I totally didn't read that. I totally didn't make that turn. Difficulty remembering things that are part of daily routine. Like, you walk out of the house and did I put deodorant on? Did I brush my teeth? I don't even know. Difficulty losing things. Where's my keys? Where's my phone? Where's my wallet? These are all kind of along the same theme of like this inattentive presentation. And for years and years and years, what people got called is, you're such a space cadet. You're kind of spacey, that kind of stuff. And it extends further than that. In terms of the hyperactivity stuff, if you were to still see residual sides of that, you might feel a little bit more fidgety. You might have more of the verbal side of things, like verbal impulsivity, like blurting out an answer, interrupting people, difficulty, especially when excited, to talk excessively. Typically, I don't see in women as much of the physical hyperactivity, maybe some restlessness, but it's not like they're like zooming around or making loud noises or like, yeah. So I think it's more verbal stuff that you still see if there's some residual signs.
And Becky asked this, and again, I get this question all the time. Like, I feel like I'm tricking my doctor into convincing them that I actually have this thing that I don't have, and maybe it's all just a ruse. What do you say to the mom who's struggling with like, maybe I just made it all up?
Yeah. I understand that. I think that part of that is a societal thing, right? We're expected as moms to be these people that have not only every aspect of our life put together, but like perfectly put together children's lives as well. So it seems too good to be true to have an explanation for that. What I've heard from some of my patients, and to some degree myself when I was going through this, is I felt like it was a cop-out, that it was so easy that I couldn't necessarily have that. What I would say is that I don't know if this is just because this has become like my entire world for the past 20 years, but like the more you immerse yourself in the human brain and how things are wired and how you kind of process information differently as someone with ADHD, it becomes very glaringly obvious that this isn't something you're tricking yourself into a diagnosis. This isn't something, it's impacting every single facet of your life. And even if you don't have the verbiage to describe it, or if you're like, if I'm describing it to another person, it sounds like I'm coming up with an excuse. It's not an excuse, it's an explanation.
Do you wish there was a way to feel confident about your day? To know exactly where you need to be, when you need to be there, and what you need to do today? I know what it's like to buy 15 different planners and not use any of them for more than a week or two. When you're tired of disappointing your family, your boss, and yourself. Imagine with me that tonight, when you look back at your day, you know that you did the things on your to-do list. You showed up well. You feel productive and accomplished. That's why I created Daily Planning for ADHD Moms, where I teach you how to keep a calendar and organize your to-do list. When you learn these skills from another ADHD brain in super short videos, they finally make sense. So now you'll be able to keep up with the commitments you've made and feel confident in how you're organizing your day. You'll walk away with an easy-to-stick-to 3-step system to keep up with your calendar and a simple way to sort through the giant to-do list and figure out what actually matters. Plus, we have a weekly accountability group so you can ask questions when you're stuck and jump back on the wagon when you fall off. Because you will fall off. That's just part of ADHD. But now you will know how to prepare for that. So if you're ready to figure out your day in a way that makes sense both for mom life and an ADHD brain, I want to help you make this happen. Join me at bit.ly/ADHD plan. That's bit.ly/ADHD plan. It's all lowercase letters. I cannot wait to see you feel confident and competent in how you run your family life.
Okay, so that was actually one of the questions that somebody asked. I'm like, who asked that? Oh, Amanda. She said, like, how do I balance that, like explaining who I am and how I work instead of it sounding like I'm trying to excuse, all the things that I didn't do or messed up on?
I think one of the things that really separates this is that, and this is why communication with whoever you're around, your inner circle, is really important, right? Because it changes the intention of that stuff. So for example, something as simple. I'll give you the beef in my family. Like my husband, it's just like, have you never heard of a dishwasher? Like, why does it not even, like, I'll put my dishes so close to the edge of the sink. I'll never put them in. I'll never put them in like the dishwasher. And he's just like, I don't understand. Like, you're so close.
Our husband
So
should talk.
close. What is this? And so I like for a long time, I was just like, I forgot. And then after a while, I was just like, this isn't helping the problem. The problem is recurrent. So I had to sit down and explain to him, I'm like, listen, David, this does not even show up on my radar. This is muscle memory. I'm putting these dishes here and then I don't even see, it's like I do not even see it. I don't see the dishwasher. And our dishwasher is kind of tricky. It looks like cabinetry. It like doesn't even register as a thing that I need to, this is my next step. And usually by the time I'm doing this, I have 1 or 2 kids on me doing other things. And so like, this is the lowest on my priority list. So I'm not doing this to put more work on your plate. Like he was getting frustrated because he's like, I feel like you're intentionally thoughtless. Like you are purposely ignoring what I'm saying because you're trying to make a point. And I was like, I swear I am not, this isn't even on my radar. So I think once I explained it to him like that, it changed the intention behind it because he thought it was something like, I'm trying to prove a point. I'm not trying to prove a point. I'm just trying to live, man. So I
feed these kids and get them to bed, man.
Yeah. So I think it changes a lot of how the people around you perceive things. And I think that you don't have to come up with a spiel. You don't have to come up with like something that you say every time, like a canned little monologue. And it doesn't have to be on the very first incident either. It's as you become better at managing and recognizing your own symptoms and also limitations, you get better at understanding like what part of this can I behaviorally modify and what part can't I do that to. And the parts that are like really recalcitrant that aren't changing with behavioral modification, that might be worth the explanation. And I mean, and it's not an excuse. It's just saying like, this is how my brain is. What I'm not looking at the same things you're looking at. This doesn't bother me in the same way.
Yeah. And I think having that conversation too, and knowing how, if I get to the sink and do the dishes at some point during the day, that's okay with me. Then my husband is super clean and he needs it to be clean after every meal. Mm-hmm. And knowing that made a difference in how I approached it. And also him understanding that like, I'm not trying to like shirk this responsibility and make it your responsibility. So I think that's a lot of where our partners feel like, well, you're just trying to get out of doing it so that I get stuck doing it. Mm-hmm. And so having that conversation of like, it's not that I am trying to make you do more work. It's that I genuinely was like juggling kids and talking about homework and all this and things got dumped. And then I moved on to something else and I forgot that the dishes never got finished. It's not that I was like, if I leave this here, I don't have to wash. And when both sides are explaining their point of view, you start to get past that, the like headbutting point.
Yeah.
Not that we have solved our dishwasher problem, but we made it way.
Yeah, so. I think I just need to get a dishwasher that looks like a dishwasher. But even then, no guarantees.
Honestly, mine also looks like wood, so I feel like on that one.
Mm-hmm.
But I had a dishwasher before that did not, and I don't think I was better about it.
So. At home, when I was living with my parents, I never did that either. So that's incorrect. Yeah.
Okay. So Lala asked about, she's like, I keep discovering new symptoms and I didn't know they were ADHD related. Is there any other like themes that you see that are obviously different in women versus men when you're talking about like that diagnosis process of like it being more than just the spacey, whatever? Like, is there anything else underlying that like, if a mom has this happening, it's like, ding, ding, ding.
Well, I'm reluctant to give you a clear-cut answer for that because, again, it's so complicated. That's why you need a physician or someone who is trained in this to be able to look at the symptoms because it could easily be other things. But with ADHD, if you're thinking about ADHD at its base, it's that your brain is moving super, super fast, right? So the problem is with a brain that is just wired to move 1,000,000 miles an hour, you're also dealing with how to deal with the rest of your brain trying to catch up. So if you're trying to organize on the fly and put things in organized places in your brain, doesn't happen. If you're trying to recall information, doesn't happen. If you're trying to be meticulous, it might be too hard to do that. And then you fall on the other side of that hyperactivity of your brain moving a million miles an hour, and you have to deal with the burnout side of things where you're fatigued and you're tired and you're irritable. And so there's a lot of that that can look like depression. It can look like a mood disorder like bipolar. It can look like severe anxiety. There are no distinct red flags that are like, okay, if you have this, this is ADHD and nothing else. And that's part of, on social media and things like that, I bring up a lot of these things that could be like even unusual things like sensory issues could be ADHD, but it could be anxiety, it could be autism, it could be so many different other things. And that's why it's important to gain awareness about what your patterns and what your symptoms are, because the only way you're going to truly figure out diagnostically what's going on is to synthesize all that information and look at it as a whole. Because if you look at one symptom on its own, it could be too many different things.
It's kind of like if you're sick and you start Googling your symptoms and it's like, you could be fine or you could be dying. Like,
yeah. Okay, cool.
Or like when you're a mom and you have a newborn, it's your first kid and you start Googling what's wrong with your kid and every single thing is like totally normal or dying. Like there's no in between.
I know. And then it's always reflux.
I remember the only time my kid had white poop.
Oh.
I was like, there's like this, they've got to be dying. Like that's so weird. And again, you Google it, either it's totally normal or they're really sick. And you're like,
yeah.
That's why you don't Google anything.
Yeah.
Okay. Now, one of the biggest parts of ADHD that's not in the DSM, and for people who are like, what's the DSM? It's the diagnostic criteria that doctors are using to decide how things all shake out.
Yeah.
But that was my highly technical term for it.
Love it.
Part that's not talked about is the emotional part and the trauma response and the rejection sensitivity dysphoria. Like, I know that I'm asking like a huge elephant of a question, but how can we take better care of ourselves in that like feelings department?
Honestly, I think it stems from understanding yourself first, right? So I think that part of when you start to recognize these symptoms and these patterns of behavior, it can be really disconcerting because you're like, what is this? Why am I feeling this? And why am I feeling it so robustly? I think as you learn more about yourself and as you learn more about your diagnosis, and maybe your physician isn't super well versed in like rejection sensitivity or the emotional criteria that comes with that. But if they're like, yeah, I think this probably is ADHD, you can go forward and kind of learn specific coping skills and things like that. And just knowing that, okay, this is stemming from my brain moving too quickly. How can I come down from this? So I think one of the most important things is one, understanding your patterns and behaviors, understanding that there is an attributable cause of those, because I think that takes away a lot of shame and guilt associated with it, that this is just coming from a me place. No, it's neurobiological. And then I think the best thing you can do with that, and this is the advice that I give my patients, this is the advice I give my kids, this is the advice I give to myself, is to be patient with yourself. Because 100% of the moments that you've gone through, you've made it through on the other side, right? You've survived through all of them. And so what our goal is, we just want progressive momentum to better control those moments moving forward. And each individual episode like that is a learning opportunity and a chance for us to utilize skill sets a little bit better and start tweaking so we're kinder and gentler to ourselves and help return back to a healthier baseline.
Yeah, I think when we get our diagnosis or we think we have ADHD, we're like, well, now I have the answer and tomorrow I shall be a different person.
Yes.
And that incremental improvement feels really slow to us.
Mm-hmm.
And we don't value it at all. I was like, as much, I was like, no, not at all. Like, we don't value it at all. We're like, I want this to be fixed. And that's not how it works.
It's not how it works, but I think that we're also trying to cover a lot of ground that's been covered, right? We're trying to retrain our brain, and that's not going to happen immediately. We need to rewire certain areas of our brain. We need to override all of those negative messages we got of years and years of being told we were lazy or stupid or thoughtless. All of that narrative needs to be kind of rewritten, or at least reframed in a way of like, okay, this came at a point of where we didn't have good understanding, but now we do. So it's a, yeah, you're right. It's a slow process and that part sucks, but it's progressive movement forward, which is what we're aiming for.
Yeah. And it's okay that we have a few steps back before we head forward again.
Yes.
But it does get better with time. And I forget who said that. Maybe it was Allie Worthington, where she's like, if you wait to start on it, like if it's going to take you 6 months to work through and you just keep pushing it off, like in 6 months, you're still going to have to do another 6 months of work. So if you start now, you're moving forward, as opposed to like, what, you're going to do nothing? You're still be in the same spot? You can, but that little bit does make a difference. We just don't feel it in the moment.
And it's hard because in the beginning, it's hard to know what direction you're going, and it's hard to know if what you're doing is actually making a difference. And so you're kind of plodding along in the dark because you're retraining yourself in ways. And that's part of why having therapists, having a doctor, having someone who's clinically trained, because again, at its base, this is a neurobiological disorder. So we need to treat it as such, right? We need to understand and be science and evidence-based in how we progress forward, and not just kind of, because everybody is a little bit different. And so things that may have worked for someone might not work for somebody else's DNA and genetics and the brain chemistry. So learning how your body responds and what you want to do to kind of rebuild those pathways is really important. And that's why it's helpful to have that guide to walk you through it.
Okay. Katie asked this question and then like 7 people joined in. They were like, yes, this. What are we learning about how our hormones affect our ADHD? And is there anything we can do in that post-ovulation to our period starting phase of where we feel awful, which is like 50% of our lives?
Really awful, yeah.
I guess 2-part question. 1, are we learning anything new about that whole concept? And then 2, is there anything we can do to live better, knowing this is a thing and not in our heads?
No and yes. So no, like it's really pathetic. Like even the studies that have come out about hormonal changes with ADHD and specifically in like this, looking at the distinction of luteal versus follicular phase of your hormone cycles, there's just not good clinical data. And so people are making assumptions. And even still to this day, there isn't sound stuff. It's that you're speculating and pulling data. What we know at this point from a very basic level is that estrogen and dopamine work well together. So in high estrogen times, you can expect that dopamine is high, and that's kind of what the ADHD brain craves and wants, right? So in these periods where your estrogen is lower and your progesterone starts rising up and muddying up the picture, your brain just doesn't work as well. You're getting a little bit cloudier. You're actually more prone to have PMDD symptoms. So like you have more PMS and low mood. And then as another layer of complexity, maybe if you're taking a stimulant medication, your medications aren't working as well during that time. So what you can do during those periods is, now that we have that kind of data, is again, because there haven't been a lot of good studies, we can't fully kind of say like, okay, how are we going to medicate this so this is never a problem? What I have seen is that for people that have robust mood changes during that time, sometimes it's a matter of handling it hormonally, like being on birth control that has estrogen in it, so that you're kind of regulating that. Sometimes people have difficulty with these low feelings right before their period, mood-wise. So maybe starting on an antidepressant at that time to kind of help, so that you're not like, because if you're dealing with executive function and focus problems, and then on top of that, you are hit with a slew of cognitive cloud, you feel like you are pushing through mud, you feel just low and not interested in being around, how are you expected to parent or do anything else? Like, it's just like, that's an added layer of so much complexity. So that might be the other thing. And then finally, in terms of medication management with like ADHD medication, some people, they do increase their medication slightly during that time. It just hasn't been well studied for that indication. So, I mean, technically it would be off label during that time. Now, we could say that historically that might be effective, but the problem is that once you start monkeying around with medications, especially stimulant medications that you would have to increase, you're also looking at a slew of potential side effects that you could be dealing with. So you're weighing risk versus benefit.
I'm like, I have 400 more questions for you, but I do need to like wrap up soon. So I'm going to do the lightning round questions where you just have to fill in the blank. You don't have to explain anything.
Okay.
And before we do that though, I know that there's going to be a whole bunch of moms listening that are like, how do I get on Dr. Sasha's schedule? So would you let us know, like, is that an option for moms to work with you? And is there restrictions on like location and what have you, so that you don't have 100 people calling you tomorrow?
Yeah, for a lot, when I started this social media thing, it just kind of exploded. And I had to shut my practice for a while because like I was booked out for 13 months. It was just absurd.
Oh my God.
Since then, I think I've fallen into a good swing of things, and it started, honestly, the holidays weren't nuts, but since then, literally this week, I opened up to new patients again. I'm taking patients in Kansas and Missouri that I can see. I'm doing 100% telehealth. So yeah, telehealth laws are weird right now as things are starting to roll back. Prior to that, I could see people out of state a little bit better, but I can't now just because they're starting to pull back things. So yeah, they can if they want to.
So if you're in Kansas or Missouri,
yes,
call Dr. Sasha. If you're somewhere else, you're on your own.
Yes,
just go back and listen to earlier when we explained what to do. Okay. All right, lightning round question. So just fill in the blank. You don't have to explain, just.
Got it.
Okay. Number 1, the best thing that I've read or listened to recently is?
Pinkalicious.
Number 2, my most boring about me fact is?
I really enjoy spelling.
Number 3, when I'm having a rough day, my go-to quote, song, poem, book, activity, whatever, is?
Early 2000s pop music.
Don't tell anyone I
double dip with chips and salsa. I don't even care who's eating it with me. I'm a germ factory.
Number 5, if I had a magic fairy wand for one spell, I would
have the ability to manipulate time.
Number 6, my best piece of advice for mamas with ADHD is?
Be patient. Be patient.
And then how can the moms find you now that they've fallen in love with you?
Oh, you can find me on social media. I'm the Psych Doctor, MD, and doctor is DOCTOR. Or you can type in my name, Sasha Hamdani, and I'll come up. They could go to my website, but I did my website myself and it was kind of terrible. I mean, there's good information, I guess, but it's not cute. Yeah, but other than that, and I don't know if this is of interest, and I just found out it's going to get pushed back, but hopefully if everything goes as planned, my first book on self-care for people with ADHD is coming out in January.
Oh, congratulations.
Thank you. Thank you. It'll be exciting if it ever actually does come out. I don't know. Pandemic made everything weird.
It made everything weird.
Yeah.
Well, thank you so much. I so appreciate you sharing with us and really being encouraging for moms who are struggling with where to start. This is really helpful. Thank you.
You are so welcome.
Hey there, Mama. I've got something fun for you. Who doesn't love a quiz? I want to know, which mama animal are you? Because you're not your average mama bear. You have a magical ADHD brain that puts a sprinkle of brilliance on everything you do. Sure, you may have forgotten that laundry in the washer for the 3rd time, but what are your strengths? What makes your ADHD parenting style unique to you? How do you use that sparkle to bless your family? So which mama animal are you? Find out by taking the quiz, What's Your ADHD Mama Parenting Style? Because you're not your average mama bear. Head on over to patriciasung.com/quiz and find out. And then when you do, I want you to post your results on social media so we can see that you're #not your average mama bear. Along with the hashtag I'm a mama, and then fill in the animal that you get. Again, that's patriciasung.com/quiz, and I can't wait to see what you get. So tag me at Motherhood in ADHD. For more resources, classes, and community, head over to my website, motherhoodinadhd.com.